The technique uses a blood pressure bulb with a finger cot attached to it. This is inserted between each of the 3 nasal turbinates, then expanded inside the nose. This creates a mechanical force which moves the bones of the skull. I have found this to be very effective in treating patients who continue to have problems with headaches, dizziness, fogginess, tinnitus, and TMJ pain. It made remarkable changes in my own sinus problems. I have seen symptoms change in my patients, usually after 4 to 10 treatments. There are many people who have not been helped by standard concussion care. In my experience, this is one of the most effective treatments I have found to help concussion. I'm going to demonstrate nasal release technique. I use a blood pressure bulb with a finger cot attached to it. Initially, when I see a new patient, I insert it in between the turbinates and I only do 1 inflation. As the patient comes more, I then add more inflations and I add more balloons to increase the pressure. Nasal release technique involves 8 insertions. I put it in between the lower turbinate, in the middle turbinate, and the superior turbinate. And then I go back down and retreat the lower. That balances things out. The first insertion is in the lower. I do the right and the left. This affects what's called the maxillary and palatine sutures. Those are on the roof of the mouth. The second insertion goes up and in at a 45-degree angle. This affects the zygomatic sutures, or the zygoma bone, which is your cheekbone. The third inflation affects the sphenoid bone, which can be seen on the outside of the head. It is also on the inside of the head, and this is actually where the pituitary sits. It sits on top of the sphenoid. So when we get this very deep bone manipulated or mobilized, it really affects the hormonal system and a lot of things in the body. The last insertion is done up and back. My patient has had this technique done on him numerous times. For the purpose of this video, I'm using 2 balloons on my blood pressure bulb and I'm going to inflate it 4 times. The first insertion is between the lower and middle hiatus, and that's the insertion that gets the roof of the mouth. He takes a deep breath and I'm going to inflate it 4 times. I then do the same thing on the left, lower. I have him take a deep breath, and he holds it. 2, 3, 4. I then take it into the middle. That's at a 45-degree angle. I have him take a deep breath and hold, and this gets the cheekbone, or the zygoma sutures. I do the same thing on the left side. He takes a deep breath and holds it. I then do it in the superior, and that's directly back, directly up and back. He takes a deep breath and holds, and that gets, as I said, the sphenoid. Then I take it into the left, directly up and back. He takes a deep breath and holds. And then I balance it out by going back into the lower. He takes a deep breath and holds. And the left side. He takes a deep breath and holds. Can you tell us what you felt from the procedure?
You feel the expansion of the balloon and pressure as well, and then occasionally you experience the cracking of the bones shifting.